Things I refuse to do as a surgeon, and I have always refused. There are certain things in plastic surgery and very relevant in hair transplant surgery that I simply refuse to do. And this is not because they are impossible, because I believe they can harm patients mostly in the long term. And in an industry that's increasingly driven by marketing, by social media influences, and aggressive transformations, sometimes the most important thing a surgeon can say to a patient is actually, no, I don't think this procedure is right for you. So today I would like to discuss the things that I personally refuse to do as a hair transplant surgeon, and much more importantly, why. I'm a hair transplant specialist and a board-certified plastic surgeon based in Harley Street in London. I believe that today one of the big misconceptions in modern hair restoration is that bigger always means better. So what does this mean? Lower hairlines, higher density, sometimes unnatural, more grafts, sometimes more than what's actually needed, and faster transformations. But the reality is, hair transplantation is not simply about creating an impressive result today. It is actually about protecting how a patient will look years from now on. One thing that I refuse to do is lower hairlines too aggressively. I strongly believe that a low hairline may look attractive, let's say a 24, 26-year-old patient, but the face changes with age. Hair loss progresses, facial proportions evolve, and what once looked youthful can eventually appear unnatural at the age of 35, 40, certainly 50. Now here where the problem is, that many patients request celebrity-style hairlines without understanding the long-term consequences. Every centimeter lower dramatically increases the number of grafts which are required to achieve a proper result. So those grafts come from a finite donor area, meaning that an aggressive design early on can compromise future options later in life. A natural hairline should age gracefully and not look surgically obvious 10 years later, or even a year or two later. I also refuse to overharvest the donor areas. This is one of the most damaging mistakes in hair transplantation today. The donor zone is not unlimited, and once the grafts are removed excessively, the donor area can become visibly depleted, what we call patchy, and heavily scarred. Unfortunately, correcting donor area damage is often far more difficult than performing the original surgery itself. Good surgery should not simply think about extraction, but should also think equally important about donor area preservation, because patients may very well still need grafts years later. Another thing that I refuse to compromise on is unrealistic expectations and unrealistic density. Social media nowadays has created a major confusion around what natural density actually looks like. By the use of fibers, lighting, different angles of photography, definitely editing, and some selective photography, they can completely distort one's expectations. But proper density is not simply about placing as many grafts as possible. Actually, I found that too much density placed in the wrong area can dramatically compromise blood supply, graft survival, overall naturalness, and can cause skin and tissue healing problems. Sometimes softer, strategically planned density, actually I find that creates much better result and a far more believable result. Also, surgery without stabilization of hair loss. I refuse to rush patients into having a procedure when their hair loss is clearly unstable, because hair transplantation definitely will not stop future hair loss. If the surrounding native hair continues to thin aggressively after surgery, then the patient can expect up chasing future procedures repeatedly. And this is why discussions about medical stabilization, other types of treatments are extremely important to have in clinic. Ethical surgery will require long-term planning and not a short-term sale. And finally, I will talk about the unsafe mega sessions, these very large procedures that are heavily marketed online, but larger is not always safer. Excessive surgical duration with poor graft handling, prolonged surgical time, never mind staff and also patient fatigue, aggressive extraction, aggressive and very long planning can all negatively affect the outcomes. A lot of times patients are focused only on graft numbers, but an experienced surgeon knows that the focus should be on graft surviving, healing, donor area preservation, long-term sustainability. And I believe the patients deserve honesty and not just impressive marketing. And sometimes ethical surgeries will mean performing fewer grafts, having that honest conversation, planning ahead. Sometimes it might very well mean staging procedures. Other times it might mean delaying surgery altogether, because this will be the responsibility of the surgeon equally to the patient, and not simply create a change today, but protect the patient's future appearance as well. The best hair transplants I found are rarely the most aggressive ones, but are the ones that have been performed by surgeons in clinics that plan ahead, and these results will be the ones that will look natural many years down the line. Thank you very much for watching this series. Remember that great surgery is not about doing the maximum. It's about knowing when restraint will create an overall better result.